Okay, thank you for the nice introduction. So indeed, the talk will, in the next 50 minutes, go about smart pseudonymization in the Belgian public sector. My name is indeed Christopher Slippe. Smalls, maybe not everyone knows Smalls very well. It's a service provider for the public sector, an IT service provider. We offer know-how, staffing, development, and infrastructure. Also this year, we're again a top employer. So physical masks, I think that physical masks are quite intriguing objects. I mean, they already exist for thousands of years, and they are being used for all kinds of reasons, such as just physical protection of the face, for theater, for rituals, even for torture. And that's also interesting for hiding the identity of the person wearing the mask. And then when we saw the advent of writing, and more specifically the advent of the printing press, we saw also a written version of the physical mask and the written pseudonym. A pseudonym, that's a Greek word. It means fake name. And we all know examples. We all know examples such as Banksy, that's the pseudonym of a street artist. I guess most of you also know Satoshi Nakamoto, which is the pseudonym behind the person who invented Bitcoin. So with the digitalization, we also saw a more advanced version of the written pseudonym, the digital pseudonym. We will see that we can do a lot more sophisticated things with it. And we'll also see that it plays a crucial role to protect the identity, the privacy of citizens in the context of the public sector. So more specifically, we will talk about 3 systems for smart pseudonymization. Smart pseudonymization, we talk about pseudonymization here as identifier pseudonymization, which means conversion of a social security number, a register number, a citizen identifier into a unique code. So at Smalls Research, we developed and prototyped these 3 techniques for observing pseudonymization: the blind pseudonymization service of eHealth and also Oblivious Join. The blind pseudonymization service is already used today. I will talk later about it, but let's start with format preserving pseudonymization. So I guess that most of you are aware that before an application goes live, before it goes into production, we first at least pass a test phase in a test environment and a acceptation phase in an acceptation environment. And only if everything goes perfect in the acceptation environment, only then the application goes live, goes into production. And this cycle is repeated for each update of the application of the service. We will see that format preserving pseudonymization can help us to better protect personal data in test and acceptation environments of legacy applications. So let's first go to the problem statement. Unfortunately, there's a widespread use of personal data in non-production environment. The World Quality Report of 2020 said that 60% of organizations use raw production data in test environment, or at least they admit that they do it. So this results in data breaches from non-production environments, such as the one of Uber, the one of T-Mobile, and the LastPass in 2022. So the risk is non-negligible. Also associated with the security risk, there's also a compliance obligation, compliance with the GDPR. If we use personal data for test and development purposes, what we basically do is we process personal data. So we need a legal basis. And only in exceptional cases, the citizen has given their explicit and actively given consent. So this will only rarely be a legal basis. The second possible legal basis is a legitimate interest, het gerechtvaardigd belang of the organization. But I've talked to several TPOs in the public sector, and they say that this is a questionable legal basis, especially when we talk about special categories of personal data, such as data about minors, such as medical data, criminal data, data about sexual orientation. So that's the first question: what is the legal basis of using personal data in test and acceptation environments? If we process personal data, in any case, we need also have the appropriate measures in place. If you read the GDPR, you will see a lot of references, a lot of the mentioning of the word pseudonymization. Pseudonymization is encouraged by the GDPR to protect personal data, and the advantage is if we correctly apply pseudonymization, then some rules in the GDPR are relaxed. So pseudonymization can help us to become more compliant. So let's have a look at a high-level overview of the reality in the public sector. So we have several public sector organizations. They have one or more applications. Each of these applications has at least a test, acceptation, and production environment. And what complicates things is that these applications, they communicate with each other, or they also communicate, they exchange personal data from external sources with external sources. These exchanges, they happen in the production environment, from the production environment, but also from the acceptation environment, less in the test environment. So there was a public sector organization, a customer of Smalls, who came to us and said, and they had a very simple question: how can we improve the privacy in test and acceptation environments under this assumption that completely fictional data is not an option? Why is it not an option? Well, because of what I just explained. There are all these exchanges of personal data between applications also with external sources. So imagine that an application creates fictional data about fictional citizens and then asks extra data about this fictional citizen from another application, and the application will probably not know this this fake citizen. So that's something that complicates things a lot. Also, the rules in our sector can be quite complicated. And if we make completely fictional data, we would miss edge cases that do happen in reality. Then also our data models can become quite complicated. And if you add all these things up, well, then you come to the conclusion that working with fictional data would become very labor intensive, would cost a lot of money, a lot of taxpayers' money. So we came up with a concept. Here you see the current practice of our customer. So what basically happens is that a snapshot is taken from the database from the production environment and imported into the database of the acceptation or the test environment. What we propose is that we do some manipulations, some transformations on this snapshot that are quite simple before it's being imported in acceptation or test environment. We will see that way the privacy of the citizen will improve a lot. So here on the left, you see a fictional snapshot with structured identifiers and the social security numbers, the register numbers. Then we have the unstructured identifiers, first name, last name. Then we also have domain specific data. So with the identifiers, what we do is we pseudonymize. What does that mean? In this specific case, we replace every social security number by a pseudonym that has the same structure of a social security number. And why is this important? Because we do not want to modify our legacy application or the underlying database. The legacy application is expecting as identifier something that looks like a social security number. So this property format preserving character is very important. In the case of the application of our customer, first name and last name, well, there it suffices that we just do a shuffle on each column. That means, more scientifically, we do a column-wise permutation. So Casper becomes Melchior, Melchior becomes Balthasar, Balthasar becomes Casper. We do something similar with the surnames, with the last names. So that way we obtain 3 new columns, and these columns, they replace the original 3 first columns in our snapshot. This results in our transformed snapshot, which we will import in our acceptation or test environment. You see that the domain-specific data, that's something we don't touch because that's something that the application needs to know to do what it is supposed to do. So there we don't have a lot of degrees of freedom. But anyway, we see that here the resulting transformed snapshot is still useful in test and acceptation environments, while it's still hard to identify. What is important, what we will see, what is necessary is that so we converted identified into pseudonyms, also the inverse operation. converting a pseudonym back into an identifier needs to be supported. But I will talk later about it, and it will become clear why. The shuffle operations, they can just be a one-time operation. There is not needed to do a to be able to compute the inverse. So here you see again the original picture of how our customer is working today. And this is the first step of the new solution. The original snapshot is transformed. So we do this shuffle operation, we do this pseudonymize operation, and the result is important in this case in the acceptation environment. The shuffle operation, that's something that the customer does locally in their transform tool. The pseudonymize, that's outsourced to a pseudonymization service, which is at the moment run as an experimental service by Smalls Research. So we talk about the proof of concept here. Okay, but then of course, from the acceptation environment, we still need to be able to communicate with the external world. How do we do this? Well, we add a proxy. Also, this proxy communicates with the pseudonymization service. So imagine that the acceptation environment wants to know if the citizen that it knows only under pseudonym 22.51 and so on, if this citizen is entitled to a reduced co-payment, en verminderd remgeld. So what happens? This message is intercepted by the proxy. The proxy extracts the pseudonym 22.51 and so on, sends it to the pseudonymization service. Pseudonymization service sends back the original identifier, and the proxy replaces in the message the pseudonym by this original identifier, and then the message that contains the real identifier, the social security number, is forwarded to the external world, and the external world can deal with this message. And then if there are incoming messages, well, then we do the opposite. So now you can ask, why do we outsource the pseudonymization operation and the inverse identifier operation? Well, it simplifies the logic at the side of our organization, our customer. Secondly, it allows us to create a generic service, something that's used by not only this customer, but also by other public sector organizations. And also it creates a nice separation of duties. Separation of duties, that means that the entity managing the protected data and the entity managing the protection keys are two separate entities. So this is just beneficial for the security. So this is our new picture. So we have a pseudonymization service, which is contacted by many applications. We want that for a given environment, the pseudonymization service always converts an incoming identifier into the same pseudonym and vice versa. We could realize this, as suggested in the slide, by using lookup tables with a column with identifiers and a column with the pseudonyms. Then we have lookup table for each environment that uses format preserving pseudonymization. But each such lookup table can become quite big, can contain hundreds of thousands, even millions of records. It also grows constantly, or it changes constantly, because there are, for instance, people entering the labor market, people leaving the labor market, retiring, and so on. So instead of working with these big changing lookup tables, we decided to work with very compact cryptographic keys, 32 bytes for one key per environment. Also, these keys, they stay constant over a longer period of time. So by working with these cryptographic keys, we reduce the infrastructural complexity of our pseudonymization service. It's also easier to secure a small key compared to a big lookup table. So that's one advantage of this solution. Secondly, as I already told, the pseudonyms are format preserving. That way, there is no impact on legacy applications. But then an open question, something I haven't talked yet about, is how can we, with a simple cryptographic key, convert a social security number into a pseudonym that has the same structure of a social security number? It's clear that with traditional encryption, which you see on the left, this is not possible. If we do an encryption of a social security number, we will lose all structure. But there is this technology which is relatively young. It's called format preserving encryption. And if you encrypt a social security number, the output of the encryption, the ciphertext, has the same structure as the input, as the original social security number. Maybe you know that the two last digits of a social security number are the checksum. Also, this kind of logic is maintained in this operation. So that's what we use under the hood. So we built an experimental service consisting of basically two operations, the pseudonymize operation and the identify operation. The identify is the invert of the pseudonymize operation. I think also the pseudonymize is quite straightforward. So you can send one or more social security numbers, citizen identifiers to the pseudonymization service, which converts them into structure preserving pseudonyms, which are then returned to the requesting entity. That's a REST service. Here in this slide, you see you get a bit of an idea of how this REST service can be used and how it replies. So you see on the left a request that is sent to the pseudonymization service. It contains for a specific environment 10 identifiers. And then at the right, you see the response which is generated by the pseudonymization service. So for instance, identifier 18.32 in line 8 of the post request is converted into the pseudonym 30.43, which you see in line 15 of the post response. The post request contains also a few malformed identifiers, such as the one in line 11, which does not contain a correct checksum. In that case, also our service is able to deal with this in a graceful way. It basically says, look, I couldn't convert it to a pseudonym because there was an error in your identifier, and we found a checksum error. So what we have here is that we have a service that's easy to use. It has graceful error handling. It's also efficient. Why is it efficient? Well, because we do not use public key cryptography, we use symmetric cryptography, which is always much more efficient. Okay, let's go to the conclusion of our first technology for observing pseudonymization. Well, we have seen that it is a useful building block to improve privacy in test and acceptation environments, but it's a partial solution. We have seen that our customer also needed to add this shuffle operation. If we work with other customers, with other applications, maybe something different or something more will be necessary to obtain data that is sufficiently well pseudonymized. So with a sufficiently low re-identification risk. As a service, I also explained why we created a pseudonymization service because of separation of duties, simplifies the logic at the side of our organization, and it also stimulates reuse. At this moment, this is an experimental service, but we are now in the phase that we are trying to find support to go into project mode to bring this service live. Because what we hear is that it would be a very useful service. It's relatively simple, but definitely useful in our context. Okay, we have seen that format preserving pseudonymization can be used to better protect personal data in test and acceptation environment of legacy applications. It would be better if already during the design phase of an application, we think about how pseudonyms could be used to better protect personal data. That way we can achieve a higher level of security, a higher level of privacy protection, not only in test and acceptation environment, but also in the production, in the live environment. So this application is already live as a service. It's already used to protect personal data. So if you live in Belgium, there's a good probability that this is already used to protect data about you. So let's first go to the problem statement. Well, the problem statement is quite simple, and there are simply way too many data breaches. And unfortunately, there is no silver bullet. But fortunately, there are a number of principles that can help us. And here I give 3 of these principles. Privacy by design. Privacy should be taken into account when designing and building products and services. Separation of duties, I already mentioned this. The entity managing the protection keys should not have access to the protected data and vice versa. And then my favorite design principle is simplicity. Why? Because complexity is the worst enemy of security. Based on these three principles, we developed a highly secure solution that, as I already mentioned, is already in use today. So let's start with the use case, the referral prescription. I'm sure you all know referral prescriptions, verwijsvoorschriften. It's a certificate issued by a doctor to start a certain treatment, for instance, to start physiotherapy, kinesiotherapy with the physiotherapist. Then you can, for instance, go 10 times to the physiotherapist. So in 2022, I was contacted by the project team that was responsible for implementing the platform, the system for digital referral prescriptions. Here you see two very simple scenarios. Scenario one, the doctor uploads a new prescription to the prescription service. A prescription consists of a citizen identifier and also of the prescription data. So together they form the prescription. Then scenario two, the physiotherapist would like to have access to the full prescription given the identifier of a specific citizen. So the identifier is sent to the prescription service looks up the prescription data and returns the result to the physiotherapist. Okay, two very simple scenarios, but there are two important security requirements. The first is pseudonymization. The prescription service should never be able to link prescription data to a citizen. That's one. Second important requirement is partial encryption. So prescription data consists of several fields. We want to encrypt a few of these fields in such a way that the prescription service cannot access these fields, cannot decrypt them. But of course, an authorized healthcare professional should be able to decrypt these fields. So let's start with the pseudonymization. Here you see the flow with which we start. So the doctor sends an identifier to a new pseudonymization service. Pseudonymization service converts the citizen identifier into a pseudonym. Pseudonym is returned to the doctor. Doctor sends the pseudonym together with the prescription data to the prescription service. So that's already, at first sight, a good start because our prescription service no longer sees citizen identifiers, it only sees pseudonyms. But if you look a bit more thoroughly, you see that we have created a problem that's maybe even worse than our initial, that what we wanted to solve. Our pseudonymization service sees all incoming identifiers. That means that it can compose a profile about each citizen. How? Well, it sees for each identifier what doctor, so it basically sees which doctor issued a prescription to me. It also sees which physiotherapist had access to my prescription data, to my prescription. So the pseudonymization service can compose profiles about each citizen's profiles with medical data. That's something we want to avoid. So what did we do? Well, before this, the doctor sends the citizen identifier to the pseudonymization service, we will blind it. Blinding, that's a kind of short-term encryption with a key that's only used once. At the top of this slide, you see an example of how such a blinded identifier looks like. And this is sent to the pseudonymization service, which converts it to a blinded pseudonym. Blinded pseudonym also has the same structure as what you see on top. It is sent back to the doctor, and only the doctor can do the unblind, which results in the pseudonym. And then the pseudonym is, together with the prescription data, sent to the prescription data. So now we have created something quite cool in the sense that we have a blind pseudonymization service. Pseudonymization service no longer sees identifiers, no longer sees pseudonyms. So that's already a big thing. But there is still there's still a risk that we would like to eliminate. And what is this risk? Well, the doctor still sees for each identifier the corresponding pseudonym. So it can make this, it knows these links between identifiers and pseudonyms. Also, there are many doctors and healthcare professionals, tens of thousands of healthcare professionals in this country. And these client applications are not always very well protected. And so a hacker could compromise a dozen or maybe a few hundreds or maybe thousands of these doctor clients, the software, and then create a quite extensive list with identifier pseudonym couples. Then imagine that this hacker publishes this list with identifier pseudonym couples. Then for an administrator of the prescription service, it becomes trivial to link the prescription data to citizens. That's something we want to avoid too. So what do? We introduce an extra encryption and decryption step. So the blinded pseudonym generated by the pseudonymization service is encrypted. So the encrypted blinded pseudonym is then sent back to the doctor. The doctor can only remove the blinding, cannot remove the encryption. So the unblinding results in an encrypted pseudonym. The encrypted pseudonym is sent by the doctor together with the prescription data to the prescription service. Only the prescription service can do the decrypt and obtains that way the pseudonym. And now we already have something that is quite high in security, because each party only sees what it needs to see. The doctor only sees the citizen identifier, not the pseudonyms. The prescription service only sees the pseudonyms, not the citizen identifier. And the pseudonymization service sees neither. There is then one small thing that we added that's before the pseudonymization service does the encryption. It adds context data, such as a timestamp. That way the prescription service is sure that the encrypted pseudonym that it receives is fresh, is valid. Okay, so that was our scenario 1. The doctor uploads a prescription to the prescription service. There's also this scenario 2. The physiotherapist knows the identifier of the citizen, and then thanks to this pseudonymization flow, the prescription service only sees the pseudonym, then looks up the corresponding prescription data and sends it to the physiotherapist. So I focused on the pseudonymized operation. There's also the identify operation, which is the inverse, which converts the pseudonym back into an identifier. And then there's also the convert operation, because in the e-health ecosystem where the prescription service is running, also other services will be running, such as a service that maintains your vaccination data. And these services, they all use pseudonyms. And for each service, a different pseudonym is used. I'm known under pseudonym A by the prescription service, under pseudonym B by the vaccination service. And I told you that these services, they need to communicate with each other. And the convert operation allows us to convert a pseudonym known by prescription A into another pseudonym known by service B. And it turns out that these 3 operations, they are necessary and also sufficient to offer the pseudonymization service as a generic service. And thanks to this generic service, which will be used by many services, we can really offer a high level of security. Another nice aspect of this solution is also the direct communication between the healthcare professional and the prescription service. All communications happens directly over one channel. There are also alternative solutions possible in which a pseudonymization service sits in between the physiotherapist and prescription service, which is a less elegant solution. And the last aspect that's also very nice of this solution is that it's low intrusive client side. What do I mean by this? Well, there are in this country dozens of software vendors that develop the client software for the healthcare professionals. And all these software vendors, they need to integrate the blind and unblind logic in their client. Fortunately, it turns out that this is quite simple. That's one advantage. And secondly, what's also very good here is that the clients of the healthcare professionals, they do not need to manage long-term cryptographic keys. That's always a hard thing. I mean, there's no one who likes the management of cryptographic keys. They're just hard and a cumbersome job. Okay, so let's go back to our initial use case, the referral prescription. So we talked so far about pseudonymization, but there was also the requirement of partial encryption. Partial encryption, so prescription data consists of several fields. We want to encrypt some fields in such a way that only authorized healthcare professionals can decrypt these fields, in such a way that the prescription service can never access these fields, these encrypted fields, the content of these encrypted fields. So how do we do this? Well, the nice thing is that we can do this in exactly the same, using the exact same flow that we have already seen. So here, you know this flow. An identifier known by the doctor is converted into a pseudonym known by the prescription service. So let's assume that the doctor wants to encrypt data that you see in the upper left corner of the doctor frame. So what will the doctor do? It will create a new fresh key specifically to encrypt this data. A key, generating a key, how do you do this? Well, that's just generating some random bytes, 32 randomly generated bytes. With this key, it encrypts the data and it sends the encrypted data to the prescription service. So that way, the prescription service indeed cannot access the content in this encrypted data. But of course, we should maintain the possibility that other healthcare professionals will read the prescription, will contact the prescription service, that other healthcare professionals will need to be able to decrypt encrypted data. So somehow, authorized healthcare professionals need access to the key. So what do we do? Well, the pseudonym that you see, the pseudonym is in fact an encryption of the identifier. And we do exactly the same thing with the identifier as what we did we do exactly the same thing with the key what we did with the identifier. So the key follows the exact same flow, which means that the key known at the site of the doctor is converted into a pseudo key known by the prescription service. So pseudo key, that's a kind of an encryption of our original key. And the prescription service cannot have access to this original key. So prescription service sees the encrypted data, sees the pseudo key, sees the pseudonym, but does not see the original data, does not see the original key, does not see the original identifier. So that's how we encrypt. And now let's assume that another healthcare professional wants to access this encrypted data. Well, here you see the flow to convert a pseudonym known by the prescription service back into an identifier known by the doctor. That's with the identify operation. The details of the identify operation are not that important. What is important that the converting the pseudo key known by the prescription service into the original key known by the doctor follows the exact same flow. And then, of course, decrypting becomes trivial. The doctor knows the key, simply retrieves the encrypted data, and can then decrypt. So what we have now is that only authorized healthcare professionals can access the data. The prescription service and the pseudonymization service cannot access the data, cannot access the key. And there is basically no new logic required to add the encryption-decryption functionality. The doctor needs to be able to generate new keys, to do encryption and decryption operations, but that's quite trivial. That's easy. That's not hard. So this gives at least an idea how we can use our pseudonymization service to encrypt data in such a way that the prescription service cannot access it. Okay, what is important in this solution, of course, is that our pseudonymization service is independent, is well secured, and it has proper access control. Okay, so far our use case of the referral prescriptions. Let's now briefly go to another use case. So Cienzano, which you see at the bottom of this slide, I guess you all know Cienzano. It's an esteemed Belgian health research institute. It played a very visible role during the COVID pandemic. And what it does, it collects specific data from hospitals, for instance, about COVID or diabetes. And a single hospital can, of course, deliver data about many citizens. Also, several hospitals can deliver data about the same citizen. But Cienzano does not need to know, should not know the identifiers of these citizens, so it only knows pseudonyms. So how can we, using our pseudonymization service, allow Cienzano to combine data about the same citizen originating from different hospitals without knowing the original identifier? Well, here you see the exact same flow that we already have seen a few times. Identifier known by hospital A, citizen identifier known by hospital A, is converted into a pseudonym known by Cinsano, and over the same channel also data known by that hospital about that specific citizen is sent to Cinsano. And hospital B basically does exactly the same. You see exactly the same flow, but mirrored. And so hospital A and hospital B, because they give the same identifier, the same citizen identifier to the pseudonymization flow, the output of the pseudonymization flow at the side of Cinsano is the exact same pseudonym. And that way, Cinsano is able to link data about the same citizen originating from different hospitals to each other. So that's a proposal. So that's not yet being used today. It would have the advantages that I have already discussed, basically that each party only sees what it has to see. We have this direct communication between hospitals and Cinsano, and we have this low intrusiveness at the side of the hospitals. But there's another new advantage, and that's efficient reuse of existing infrastructure. What do I mean by this? Well, we talked about prescriptions. Prescriptions are mainly issued and consulted during business hours, which means that during the night, our pseudonymization service has a lot of available capacity. Then during the night, we can do these join and pseudonymize operations, which are not time critical. Okay, so let's go to our conclusion. I think that this the eHealth pseudonymization service, that it's a nice example of privacy by design. It's also a nice example of separation of duties. So the pseudonymization service and the prescription service are separate entities. It's also a nice example of simplicity in the sense that the identify and pseudonymize operations are done in the exact same way as encrypt and decrypt operations. And also integrating this logic client-side is quite simple, as I have already justified. The service is live today, and it knows an uptake. So it is being used, or it will in the near future be used to protect electronic prescriptions, medical records, vaccinations, fertility data, and so on. So let's go to Oblivious Join. So we have seen that eHealth's blind pseudonymization service can be used to join and pseudonymize data for research purposes, by Cinsano, for instance. But sometimes we need something more powerful if you want to join and pseudonymize data, personal data, for research purposes. And that's why we came up with Oblivious Join. So let's go to the problem statement. Regularly, researchers, typically from universities, they come to us with the need to answer very specific research questions. And in order to answer these specific research questions, they need access to personal data. They need access to pseudonymized personal data. And very often, data originating from different sources needs to be combined in order to do so. So here you see an example of such a real world research questions. Do multiple sclerosis patients who take medications with certain molecules, do they have an increased cancer risk compared to multiple sclerosis patients treated with other medications? That's a fairly simple and valid question. We need to answer this question, we need information delivered by the IMA, Intermutualist Agency. We also need data delivered by the BCR, the Belgian Cancer Registry. So we need basically data about all citizens with multiple sclerosis as indicated in this Venn diagram. It's the green part. So for the IMA, it's easy. It knows who has multiple sclerosis, and about each citizen with multiple sclerosis, it delivers the required medication data. For the BCR, the Belgian Cancer Registry, it's harder. It should deliver cancer data about patients with multiple sclerosis, but it should not learn who has multiple sclerosis because that's sensitive personal medical data. We shouldn't leak this information to the Belgian Cancer Registry. At the other hand, the Belgian Cancer Registry only wants to provide the minimal required data to, in this case, this collector. I will talk later about this collector, but it only wants to deliver the cancer data about as few persons as possible. So here is basically, in essence, the problem. How can the Belgian Cancer Registry deliver only records about multiple sclerosis patients without learning who has multiple sclerosis? So you see that this is not a trivial question. How do we do this today? Well, you see an example flow at the right of this slide. And for each research question, we draw this kind of flow manually. So you understand that this is quite resource intensive. I have talked to many people in the field, and one person told me, look, it requires an exorbitant amount of resources to answer this kind of research questions. Also, this because it's for each research question, we need to draw such a new flow. It's also slow. Someone else told me, look, it lasts weeks, months, or even years before we can access the data. So that's indeed long. And also, it's quite error-prone, this approach. Here you see a concrete example. The list with all citizens with multiple sclerosis almost leaked to the Belgian Cancer Registry. Fortunately, our information security team saw this just on time, and then we found a kind of dirty solution that cannot be generalized. But you see that there is room for improvement to improve these procedures. And then, of course, the valid question is, yeah, okay, how do other countries do this? And what you see is that in practice, there's a heavy reliance on a combination of heavily trusted parties and strong legal regulations. But personally, me and also other technical people, of course, they prefer a more elegant, privacy by design solution. So here's a challenge to do this. We want a solution that allows us to join and pseudonymize personal data originating from different sources with an important constraint. Not all data sources are able to independently select the relevant records. The Belgian Cancer Registry, for instance, is unable to select the records about only citizens with multiple sclerosis. And then, of course, there are also some requirements, such as it should be privacy friendly. The involved entities learn only the necessary. That also means that the data sources do not learn any new personal data by engaging in this kind of join and pseudonymize protocols or procedures, flows. Should be uniform. What do I mean by this? Each research question is different, with different data, with different data sources. But nevertheless, the join and pseudonymize process should happen in the same uniform way to avoid the slow and expensive bespoke approach that we have seen before. No data aggregation. Well, it turns out that researchers, they need access to the individual pseudonymized records. So we cannot just merge several records into some statistics that they can use. That doesn't work in reality. And of course, the solution should be easy to use. So far, we focused on, in our specific research question, on the green area of our Venn diagram that you see on the right, which means the researcher needed data about all citizens with multiple sclerosis. We will simplify the question a bit. We will focus on the intersection, which means that the researcher only needs data about citizens with multiple sclerosis and cancer. Okay, and from there we can extend our solution. Let's jump now to our concept. We see again our two data sources. In our solution, we can of course also have 3, 4 or more data sources. We now will assume that there is a research question that we need to answer, and to answer this research question, we need to join and pseudonymize data originating from 3 different sources: the IMA, Belgian Cancer Registry, and the Federal Public Service Health. Then we have the collector, who will later provide access to the data, to the combined data, to the researcher. So it's a protocol. It consists of 3 parts. In the first part, the data sources, they will communicate with each other. It's kind of, I call it a crypto talk. So they exchange randomly generated numbers or numbers that cannot be distinguished from randomly generated numbers. And once this is done, and based on what happened in step 1, each individual data source is able to send encrypted data to the collector. It's specifically, it's in a special way encrypted with the random or pseudo-random numbers from the first step. So the Bells and Cancer Registry would deliver all data, and each data source delivers data that is, from their point of view, potentially relevant to answer the research question. So for the Bells and Cancer Registry, it means it will send in a specially encrypted way data to the collector about each citizen with cancer. That's, of course, way too much data. But thanks to these agreements made in the first step of the protocol, we can mathematically prove, formally prove, that the collector only can decrypt the data in the intersection, that it can only decrypt this data that is relevant to answer the research question. So data sources in this protocol do not learn any new personal or statistical data. There's no data leakage towards the data sources, which is a very nice property. Also, they see identifiers of their data. They do not see the final pseudonyms. The final pseudonyms, only the collector sees them. The collector, on the other hand, does not see the original citizen identifiers, which is also a nice property. The collector, furthermore, only learns the minimal required pseudonymized personal data, the minimal data required to answer the research question. In this protocol, there's a little bit of high-level statistical data that leaks to the collector, such as the number of citizens with the cancer diagnosis, but in reality, that's not an issue. So data sources only see the identifiers, collector only sees pseudonyms, and then the question is, where is pseudonymization happening? Where is our pseudonymization service? Well, the nice thing of this solution of this protocol is that it happens in a distributed way. So it's kind of a collectively calculated in such a way that only the collector can see it. So that's, sometimes with cryptography you can do very nice things. Okay. Also here, it's very nice that also, even if multiple data sources, they collude with each other, they cannot obtain more data than what they already knew. That's a very nice property. On the other hand, we should ensure that the collector does not collude with any of the data sources. Otherwise, the security is compromised. So this collector, it's an independent and semi-trusted entity. It has a few things. It should do a few things. So first of all, it should delete as soon as possible the irrelevant ciphertexts. Then the data, the pseudonymized data that it could decrypt, well, it will do a check. Typically in our sector, we do a small cell risk analysis to see if the identification risks of individual records is not too high, but it will rarely be zero. And that's why the collector will not give the raw data to the researcher. Instead, it will give the researcher in a controlled way access to this data. So that's the task of this collector. So in practice, we see that in this case, we have 4 participants of the protocol, 3 data sources, 1 collector. The 4 participants, they all download the client. For each research question, there is a JSON file that's being created. And this JSON file creates all info that is required to execute this protocol. So this JSON file is generated by a coordinating party. Can be the collector, can be one of the data sources, can be another party as well. What the data sources will also do is they will create a CSV file. The CSV file will contain all the potentially relevant identified personal data. So in the case of the Bells and Cancer Registry, it will contain identified data about all citizens with cancer. Then the protocol is run, and the only output of the protocol is the black CSV file at the side of the collector, which contains the minimal required joint and pseudonymized personal data. So let's make this even more concrete. Here you see a test that I have run. You see the 3 extracts from the 3 input CSV files. The first one contains 200,000 records, the second CSV file contains 500,000 records, and the third one contains 1 million records. And to answer the research question in this example, the researcher needs access about data about 50,000 citizens in the intersection. And then here you see the result, the black CSV file that after running the protocol that the collector obtained. So what you see is that the collector does not see any identifiers, it only sees the pseudonyms. You also here see an example of a citizen with identifier 60.01.05 that occurs in each of the 3 CSV files. Therefore, it's in the intersection. Therefore, it also has a record in the output CSV file at the side of the collector. And you see also that the information is indeed joined, the information is indeed combined. Okay, this gives a little bit an idea. A few words about the performance. Doing this test took less than 2 minutes of computations, and a few hundred of megabytes of data needed to be transferred. For a distributed protocol, that's efficient. Okay, let's go to the conclusion. I would like to share with you also that this work is not happening just by Smalls Research alone. We have a close collaboration with universities. Soon, in a few weeks or a few months, well, in this year, our first paper will be published by Springer Nature. It's an interdisciplinary paper, which means it's quite easily readable by non-cryptographers. Meanwhile, we're also working on an expert paper, which really proves mathematically, formally, all the claims that I have done in this talk. This paper is almost ready to be published to a peer-reviewed crypto conference, academic conference. But for the moment, I cannot share a lot of information about it, as long as it's not accepted. So this is my last slide about Oblivious Join. So it has a number of advantages. It's a concrete answer on a concrete business need. It's privacy friendly. We have a uniform way to join and pseudonymize data. It's fast, it's cost efficient. We have a formal academic validation. Nevertheless, we are also confronted with a few challenges. We see in the domain a lot of interest in the tool, in the protocol, but so far only passive interest. And that's also why this solution is still in the research phase. It's also because our protocol is distributed, it doesn't use this kind of central service. We have more logic in the individual clients, so we have a higher development complexity. And also we focused on these intersections, but in reality, researchers need more than only data about citizens in these intersections, so we will need extensions. Nevertheless, I think that these kind of tools offer opportunities to unlock data faster, cheaper, and more securely, which would allow researchers to do more complex scientific research. It would allow us to deal more quickly and to handle more research questions. And this could, I hope, lead to improved policymaking, improved healthcare, and improved competitiveness. So to wrap up, we have seen three systems for smart pseudonymization, and I hope that this convinces you that smart pseudonymization can play a crucial role to protect personal data. So thank you for the attention. If there are any questions, you can fire them now.